Thank you. First of all, I want to thank everyone. Good. I want to thank everyone for inviting me today. I really appreciate the help of people like Mehmet and Mike Ward and the MESS group for asking me to speak. It's a great honor for me to be here. I too would also like to express my condolences to all the victims at the earthquake in Turkey. May Allah have mercy on their souls, and may He bring sabr to those who have survived, because it is a truly terrible tragedy. I'm here to talk a little bit about the Canadian healthcare system, and my talk is more to give a little bit of a background. Our three talks are more to give a little bit of a background on the Canadian healthcare system and how it works right now. There's a little bit of information about myself up here. I'm not going to go into too much detail, other than to say that one of the reasons that I'm here is I was a former president of the Ontario Medical Association, so I had a number of meetings with the Minister of Health during my term on the OMA board. And I will be referencing some work that I did. I was the founding chair of the Georgian Bay Family Health Team, and I actually built that team from scratch starting in 2007. And I wanted to talk a little bit about what we've done there and why that hasn't been implemented across the province. Speaking after me is a woman who's much smarter than I am, and that is Dr. Sylvie Matthew. She's been on the Ontario Medical Association board, and she actually spent 4 years on the Physician Services Committee, and God bless her for spending all that time there, because she did deal with government agencies in that role, and she's got a master's in health economics and policy management and a global health certificate. And this is just a small part of her resume. I couldn't fit her resume onto the slide because it was so large. Another woman who's also a lot smarter than I am is Dr. Nadia Alam. She's also a former president of the Ontario Medical Association like I am. She also has a master's in health economics, policy and management, and she actually lectures at the U of T Institute of Health Policy Management and Evaluation. She was the one who was responsible for dragging me into medical politics, so if some of you were upset about some of the things I said when I was on my term, it's all her fault, just so you know. The agenda that we have is I'm going to talk a little bit about digital health management, because that's my area of interest. Dr. Matthew will speak a little bit on health systems funding. Dr. Alam will speak on primary care. And then we'll have a question and answer session, and we'll try and answer your questions as best we can before the break. In June of last year, Dr. Catherine Smart, who's the past president of the Canadian Medical Association, gave an interview to Bell Media. And she said, and I quote, "Canada's healthcare system is collapsing all around us." And unfortunately, I find myself in a position where I have to agree with her. And as a Canadian, this makes me very sad. And it should make all of us in Canada very sad, because no one wants the healthcare system to be in such poor shape. But unfortunately, that's where it is right now. As a physician, this worries me a lot, because I'm constantly concerned about my patients. I don't honestly know how some of my patients with chronic medical illnesses are going to get the care that they need or they deserve in the upcoming years. As someone who has a family, and as someone who has extended family members who do have chronic health conditions, I worry about my family members, because I'm not sure how they're also going to get the care that they deserve. And on a somewhat selfish level, I'm 56 now, which means that I'm heading into that demographic where I'm going to start using the healthcare system more and more, if the statistics are to be believed, as I age. Demographic where if the system is going to be viable for me as I get older. And so there's a lot of worry that all of us have about healthcare. In response to this, I'm sure you've all read the news. The federal and provincial governments, and the story's evolved very rapidly, have come to an agreement on a framework. And the Prime Minister has said that he's going to spend $46 billion in new funds over the next 10 years to try and stabilize the healthcare framework. I believe BC, Manitoba, Ontario, a few others have already signed their agreements. I don't know if all the provinces and territories have yet, but that situation is evolving. And this sounds really nice, right? It sounds great. Our leaders are getting together. They're going to work to fix our healthcare system. I'm old, right? And one of the advantages of being old is that you can tell when things are repeating themselves. In 2004, then Prime Minister Paul Martin pitched a healthcare fix for a generation that was going to provide stable and predictable funding in 2004 as part of his re-election campaign. And when we look at the 2004 fix for a generation, we see things that are remarkably similar to what's being promised now. Wait times are supposed to go down. Primary care reform to fix family health care. Stable, predictable funding. A national home care program and a national prescription drug program that was going to be in place by 2006. So 17 years later, I guess by government standards, a 17-year delay isn't bad, but there's still nothing like that. And when we look at the 2023 Accord, what we see is some, as I said, some similarities. There's $25 billion versus something called tailored bilateral agreements to address family health services, backlogs in mental health, substance abuse. But the funding conditions that they've put forward aren't exactly clear, right? Because they just said, well, we're going to cut these agreements with the government and then we're going to come up with a plan after. And of course, there is the ever-present stable and predictable funding for our healthcare system. So I'll admit I'm a little concerned about how effective this is going to be. The blunt reality is that we need someone to really take a good look, hard look at our healthcare system and transform our healthcare system and take some bold and radical steps to really reimagine how healthcare is provided in Canada. The first step, to my mind, in how to do that is to look at digital healthcare, because this is the 21st century. All our information is digital, whether we like it or not, and the way we communicate with each other is digital. And so we need to look at digital healthcare and how we use that as a basis for that transformation. Now, it's unquestionably true, as Dr. Allen will probably point out, that primary care is the backbone of a high-functioning healthcare system. I'm going to suggest, however, that a backbone needs calcium and vitamin D, and that's digital health management. Our IT systems right now are a mess if you're a physician in Ontario. This is the list of EMR, electronic medical records offerings for physicians in Ontario that are approved. There are now about 11 of them. They're made by many different companies, and none of them talk to each other. So if you're sick and you wind up in a walk-in clinic that uses a Curo, say, your family doctor will not get that information when you go to see them if they use telesuites. Right? There's no communication and no coordination. And similarly, if we look at hospitals in Ontario, there are three main hospital systems. I think there's Cerner, Epic, and Meditech that don't talk to each other. Public Health has 36 units at last count. There's about 5 different electronic record systems that Public Health uses, and some of them are still on paper, at least they were when I did my president's tour. Home care, in fairness, has one system. They use something called the CRIS system. Nursing homes, they are multiple nursing home systems, although point-click care has about 80% of nursing homes, so there is one dominant system. And pharmacies, of course, it depends which pharmacy you go to. Shoppers has their system, Rexall has theirs, PharmaSave has theirs, and so on, and none of them talk to each other easily. And so over the past 10, 15 years, the solutions the government have put out have been to put out ways to add administrative work to physicians to allow them to access this data. So what do I mean by that? We've got solutions such as hospital report management, OLIS. If a patient comes to me in my office and they say, oh, I was in the hospital last week, I can't look at their chart and have the information there. I have to then go into a separate system called OLIS. I have to click a few buttons, download, review all their labs, and then have that imported, as opposed to being seamless. Now, I want to thank the MES group because they provided me with some information on the Turkiye health system, and I think we can learn from Turkiye. And so a lot of this information is for them, so I do need to acknowledge that and thank them for this. The government Turkiye, of course, has, for people who are Turkish, they know this, they have a mandated national health data strategy, and all of the hospitals in Turkiye use the Hospital Information Management System, or HIMSS. And while it's true that many different hospitals provide different services and so may have different modules of their software, all of the data that they enter, whether it's exam work, prescriptions, lab work, etc., gets backed up for every citizen of Turkiye. And then every citizen of Turkiye is often a patient portal. And the patient portal is eNaBiz. And eNaBiz allows a lot of control for the patients to access their own data and send that data to whoever they feel it's appropriate so that they're not always communicating. And it allows other healthcare agencies to communicate with them. This slide was taken right from something the MES group provided, and again, thanks again for it. But you can see that people in Turkiye can log into that one app. They can make appointments at hospitals. They can, if someone lives in Istanbul, has a chronic condition, but goes to Antalya for a vacation, gets sick there, they can use their eNaBiz app to allow the doctors to access their records there, so everything is all seamless, right? And this allows allied healthcare service to have limited access as well to their data, which provides a seamless integrated system and allows them to collect data and makes it very powerful as to how to provide healthcare. But groups like MESS Group offer things like MESS data and MESS card, which they'll talk about. But what it means is that you can access, as a medical tourist, your records from Turkiye through the application that you're provided. So if a patient of mine decides to have a hip replacement done in Turkiye, as opposed to in Canada because of the wait times are shorter, they'll actually have more access to their records. They'll have more information about their lab work, their surgery, the report on their x-rays than a patient of mine who gets their surgery done in Canada. And I can't fathom why Canada is so far behind when it comes to this kind of stuff. These, and just so everyone's aware, these apps, they're all compliant with the Turkish data law. There's a European Union has a general data protection law, and they're also compliant with the health insurance law. So these are all very, very secure apps. So Canada needs to learn from Turkiye, as far as I'm concerned. We can learn from Turkiye if we want to begin to truly transform our healthcare system. Now, in fairness, if we look at what Prime Minister Trudeau has proposed, there is a section in the bilateral agreements that talks about health data management. But, there's always a but, right? We need some politicians who are going to stop what the current direction of the government bureaucracy is, because the current direction is to allow every possible app available. And I'll tell you what I mean by that. So when I was chair of the Georgian Bay Family Health Team, we built something called an ePrescribe project in 2009. And the first step of that was to create a system where every resident in our community had their medical records on one server only. So it only went to one place. And then allow allied healthcare professionals like pharmacists and home care workers and nursing homes eventually to access limited amounts of data. And so we created a mini Turkiye, basically, right? And so I hear stories from friends of mine who are physicians. I hear stories from them from different parts of the province where they're saying, well, I contacted home care about my patient because I was worried they're deteriorating. I sent them a fax. I didn't hear back. Then I called the patient. The patient hadn't heard. Then I called home care. They didn't get the fax. I hear my colleagues do this all the time. For me, when I'm at my office, I send a message on my electronic medical record system. The home care staff is required to check their messages twice a day. That's one of the rules we built in. I always get a message back. I always know what's happened to that information, right? And so we were able to build this, and I got so frustrated because we built this in 2009. I got so frustrated that we couldn't get this moved up to the rest of the province that I actually wrote a column about that in the Post Media called Inside Ontario's Bloated Healthcare Bureaucracy. And that column kicked up a bit of a fuss, shall we say, at the time. And as a result of that, I wound up getting invited to meet with the senior health team at eHealth Ontario. They said, okay, well, come show us what you've got. So finally I said, great. So I went there, I met with the CEO, the assistant CEO, all the senior management team. I brought all the information. I had data on how many days were saved for hospitalizations, how much cost savings, how quickly the turnaround time was for providing care, etc. And right? Because the goal from the current goal of the digital health teams is to allow anyone to have any app that they want, as opposed to unifying the system in a coherent manner. From 2018 to 2020, I sat with the digital health team at the government, the Ministry of Health, because I was on the bilateral table as in my role with the OMA. I did the same thing, and I finally said to the bureaucrat there, I said, I don't understand what you're trying to do with healthcare. Can you tell me what you're trying to do, provide for the patients of Ontario? And his description, and I'll never forget this, he said, listen, if I want to buy a pair of shoes, I've got 3 apps on my phone for e-retail websites. I put the brand of the shoe into the 3 apps, I find out which one's the cheapest, and then I buy from that retailer, and that's what we should do for healthcare. And I can't comprehend this from a physician's point of view. Now, I want to be clear about something. We should always, always respect our seniors. We should have the greatest respect for their wisdom and the work that they've done, okay? So I don't want anyone to take my comments out of context. But I'm trying to imagine how someone who's a senior citizen, who's not grown up with technology, who's a high user of the healthcare system, is going to sit there and say, I need one app, oh, I'll use this to talk to my family doctor, oh, I need something from the hospital, I'll click on this one, oh, I need something from the x-ray department, I'll click on. I can't imagine how this is going to work, right? But this is the direction that we're going in. So I've talked for a long time. In short, my version is I really, really do hope, for the sake of all Canadians, that the governments do get their act together, that we learn from countries like Turkiye who've done a great job with digital healthcare. I think it's a lesson for the rest of us. I will say that even if the light clicked, that it's going to take at least 5 years to fix this. And so in those few years, there is a really good opportunity for medical tourism, and there's a really good opportunity to build and learn from relationships from Turkey. Now, I'm going to turn this over to Dr. Matthew. I'm just going to click on her presentation for her. Sylvie, do you want to come up?